Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the founder and CEO of Paytient, Brian Whorley. How are you today?
Hey, Jared, thanks for having me. I'm great.
I'm excited to have you. Let's dive right in. Tell the audience a little bit about your background.
Yeah, thank you very much. Based here in Columbia, Missouri, I'm on a single-minded mission to help people better access and afford care. I worked at a large hospital system here in the Midwest. Spent almost 15 years inside a 400-bed community hospital. So, helping people in our community, live a healthier life was a big part of my life for almost a decade and a half. And what Patient is really that mission continued. I just sort of stared out the window and saw hundreds of thousands of people here in mid Missouri, whose sort of access to care was sort of slowed or diminished by movements into higher deductible health plans. Um, and rather than sort of like just decry and stomp my feet at the world, I decided to build something to put a feeling in everybody's purses, pockets, and wallets, and help them be able to confidently, walk into any provider's office. So, yeah, that's a big part of why I get out of bed every single day.
And although the more people I run into, like even over the last couple months, over years, everyone I run into has heard of Have You now. It seems like, and at least in my circle, but let's assume that there's people that haven't today.
Yeah,
Give
yeah.
us the kind of that broad overview of where the company is, where Patient is at today, for all the new people that are just learning about you.
Okay, yeah. Patient, we are a group of folks based here in Columbia, Missouri. We have a global team. We're 5 years in, and what we're doing is helping people to more easily and effortlessly pay for healthcare. So, I like to say that we insure care, like with an E. We pay for all the things that insurance does not. So, what Patient is it's an employer or an insurer um, uh, benefit that employers and insurers give to people and give them, credit, interest free, fee free. It's the means to turn a surprise out of pocket expense into a planned, predictable, and manageable, and again, always interest free payment plan. So we're providing security, we're providing peace of mind, we're providing confidence, we're providing dignity at scale. Um, and it just rests alongside your health plan of any size or shape of deductible, and you're able to swipe the patient Visa card at any medical, dental, vision, pharmacy, veterinary provider, and providers paid in full. We're able to get care, and then you pick a payment plan that works best for you and your family's budget. Again, always interest free, fee free for the member. And we're essentially restoring access. We're ensuring care and your ability to get care, your ability to take care of yourself and your loved ones, which is really an ultimate sort of root human emotion.
And why was this, in the early days, such a big problem for you that you wanted to go out and solve it?
I think I lived it. So my last day at the hospital came October 2nd, 2017. Within a month, I was in the emergency room, for the first time in 15 years. I had sort of bulged a disc L5S1, and I was in considerable pain. Um, Historically, if I'd been an employee of the hospital, I'd been able to easily take whatever that expense was and spread it out, and as part of a payroll deducted payment plan. Like, it was something that we did internally. It was just the way that we all paid for stuff, like in the cafeteria, for coffee, etc. Um, and I didn't have that, available to me. And I sort of thought, gosh, hey, here's something that I've known, I've loved, everybody liked to use. Like, I wonder if we can sort of package that, productize that, take it horizontally out within the marketplace, and give employers another new knob to sort of turn on the health plan design panel, um, and essentially create the means for credit to be part of the health plan design. Like, credit outside of healthcare. It's how we as a society turn infrequent, unplanned, large expenses into affordable things. Like even your home, is affordable with enough time. Even a car is affordable with given enough time. The idea that credit has absolutely no place in healthcare, I think that's wrongheaded. And I think it does have a place, but it needs to be of the right form factor. It needs to enable people and help people, and um, not diminish their dignity, not diminish their ability to get care, not diminish how they're able their buying power in the rest of their life. And so that's really kind of what we're doing.
And talk me through, how a health payment account works today,
Yeah.
and then I guess how is it different than some of these other financial tools, right? In terms of loans, credit cards.
Sure. Yeah. So, imagine you're an employer, and you are responsible for provisioning your population's ability to get care. Um, Gosh, you pick a health plan that's right size for you and your budget, your mission, your values. Whether that's low deductible, high deductible, more than likely it's going to have some component of out of pocket expense associated with it. At somewhere someone is probably going to pay an out of pocket expense. So you can either give people cash, like transfer cash to them in the form of HSAs and FSAs. Employees can match cash on those. So those are debit cards. Like you've got to put cash on there. Um, and so that's an incredibly expensive proposition. If you added up every single HSA in the country, there's probably about $100 billion worth of cash on HSAs. Much of that is actually invested, probably will never be spent on healthcare. And yet there's $500 billion worth of out of pocket expenses. So there's this huge gap out there of sort of unfunded care. We approach employers and insurers to say, hey, we will bring that buying power, that liquidity to your population. You tell us how much credit you'd like us to bring to the table. Do you want us to match the deductible, some other amount? And then we'll give everybody through our bank partnerships. Um, we'll give a Visa card with that amount of credit on the card available to you, Jared, for you to swipe and use at a provider. So that credit is just sitting available to you. Uh, should you have an out-of-pocket medical, dental, vision, pharmacy, veterinary expense, swipe the card, provider's paid. It's a Visa card to providers. So like the world works, like every provider knows how to take a Visa card. You know how to use a Visa card. You're able to swipe the card, pay the provider, and then you pick a payment plan that works best for you and your family's budget. You can also select the source of funds that's smartest for you and your family. So most folks choose a post-tax payroll deduction. Some folks choose, to repay from their bank account. You could repay from your HSA if it's an eligible expense. So we're basically providing you time to focus on what matters most in that moment, which is probably your health, your family's health. Just knock that out, take stress out of your life, choose a smarter source of funds, and ideally, preserve, protect, and grow, your HSA balances for much later in life. So you can think of, your HSA and your FSA as like debit cards. A debit card with no money on it, it's useless, right? Like try to swipe a debit card with $10 on it for a $20 copay, it'll decline. You can swipe your patient card and it'll go through, and then you can pay that $20 back again without interest or fees, on a time horizon that works best for you. And so that's what we're doing is at scale, we're improving the ability of an entire population, whether it's an employer or an entire health plan. We're improving the ability of that population to pay for care. And what happens when you improve people's ability to pay for care? Gosh, like folks get care, and that creates value, in many different ways for both people, providers, and the sponsor. And we monetize that, and that's how we create a sustainable business.
Now, when we look at talk me through some of the challenges that Americans face as it relates to these high deductible health plans. And I know you kind of addressed a lot of that, right, and how you're helping it. But if there's anything you want to add on top of that based on that prompt, have at it.
Yeah, yeah. I think I'll take the prompt too, like to not vilify, high deductible health plans. I think for a lot of people, myself included, like I intentionally choose a high deductible health plan because I think that that's the right amount of insurance for myself and my family, given how much we consume and how much risk that I want to take. That's the right plan for me versus over insuring myself and guaranteed losing money on a higher premium. I shifted those dollars into an HSA, and I'm trying to, bank and grow that for later in life. That's one, potential view of it. Anytime we have an out of pocket expense, though, like, my son got braces, here a few months ago. Like that was a big expense, and so I was able to, swipe my patient card, pay that first payment, split it up over time. Always interest free, get a discount from the orthodontist on that, and so like look, like if you have any bit of out of pocket healthcare expense, like medical, dental, vision, pharmacy, veterinary, even, Paytient makes it easier. And so, people are able to choose, the right health plan for themselves with the security and the peace of mind of knowing that, hey, I've got this like sense of liquidity, that's like independent from my own personal credit cards for like non-healthcare emergencies. Like I've got peace of mind here sort of in my pocket that I can go about living my life. And, it's a means to help people, actually choose, maybe possibly better health plans for themselves. And certainly for insurers who are like designing these health plans, they're able to sort of now think about, hey, gosh, how can we build this capability into the plan itself actually and like bundle this thing together so that, we can help people not delay, defer, skip care resort to harmful sources of financing. Like we can just make sort of the whole experience like a holistic sort of health plan feel better for the member, feel better for the provider, and that's something that we're pretty excited about.
And you like painting, right? You told me you painted that
Yeah,
that beauty behind you. I love that. Love
yeah.
the wood in there as well. Paint me
Thank
another
you.
picture. Okay. Paint me a
Yeah,
picture by explaining the process of that an employee goes through the moment they swipe their patient card at the point of care to repaying that balance. And I think this would be a
yeah.
good visual for everyone to kind of hear you paint it for us.
Okay, all right. So you work for a really thoughtful employer, and that employer says to themselves, "It really matters to me that all of our people at both ends, at all ends of the income spectrum, that everybody can easily access and afford care. That's important to me as the employer." Okay. Well, I'm not going to change, for whatever reason, they're not going to change their health plan design for that year. So they contact us and say, hey, Paytient, we want you to bring $10 million of liquidity to the table and provide that to every one of our employees. So now, Jared, on January 1st, you get an email from your employer. It's like, hey, Jared, you now have Paytient available to you. Click that email. You can download the Paytient app. So you sign in. And then once you sign in, you look and we've got a virtual Visa card right there with credit matched to your deductible. We also send you a plastic, Visa card that you can carry around. You can add Paytient to your Apple Wallet or your GPay, and you just go about living your life. You take your dog to the vet; it's a $200 expense, and you're like, oh wait. So you pull out your phone or your card, pay the vet in full. Vet's paid today. They're happy, and then you say immediately once the card goes through, you pick a payment plan and you say, gosh, $200. That's kind of stingy. I'm going to turn that into $20 out of my next 10 checks. And you just make that selection. We shoot your selection into the employer's payroll system. And then, for the next 10 paychecks, a $20 post-tax payroll election comes out of there and comes back to us to repay us. So we paid the provider $200 day zero. You're able to get care. You picked a painless payment plan that works best for you. You just go about living your life. the employer is paying us to provide that benefit, that out of pocket sort of benefit manager sort of experience for you.
And alternatively, how do you then work with the insurers?
Yeah, yeah. So we have 14, 15 different insurance partners. These are all the names that you know, and some names that you will soon know. And they're looking at how do we address affordability. They're not unaware of inflation's impact on households. They're not unaware that a real pain point for providers is getting paid, for the work that they provide. They're not unaware that the deductible is like the thorniest part of the experience. And so they, talk to patient and they say, golly, patient, like we want to actually build you into our health plan itself, or we want to sponsor you and put the patient card alongside our health plan. So we have some insurance partners where every single high deductible ACA plan member in the state of, in this state or that state or this state, every single person has the ability to download patient. So as soon as they, purchase their ACA plan on or off exchange, they receive an email from the insurer or from us to say, hey, Jared, you have, $2,000 available to you courtesy of X insurer, and you're able to use that money to pay for medical and pharmacy spend. And so for them, they're very conscious that when you improve the ability of people to pay for care, people get care, and golly, like earlier care tends to be more cost-effective care. And gosh, like I have a choice of what plan I'm buying maybe on the marketplace. Like if I one that comes with built-in interest-free, financing, like that's a better mousetrap than something else. I'm going to stay on that plan longer. So my retention, my member retention is demonstrably higher, year to year. And so, gosh, like the ability for a high churn product for a life to stay on platform longer gives me as the insurer where I'm taking risk, the ability for my interventions to help, educate and modify, care-seeking patterns and behaviors, that ultimately results in a in a total sort of, we're able to bend the cost curve, using Eric was there over a longer period of time, the longer that somebody stays with us. If you're only on me for 1 year, gosh, hard to justify, some of those interventions and investments. But if I know that you're going to be on me, I have a better chance that you're going to stay here with us for years. Gosh, like we can make those investments. And so a lot of those value props translate, from ACA to the employer side and others.
Really interesting. I love the approach on both sides. Well, you actually have multiple sides, right? Because you're working with insurers,
Yeah.
working with employers, you're working with
Yeah.
which is no easy task. So kudos to what you and your team have built. It's really incredible.
Thank
What's
you.
what's next that is really exciting you that you can share with us today?
Right now today we're enabling something like almost 800,000 people to more easily pay for care. That's awesome. Like that fills our team with pride, and we serve those folks, uh, with just a deep sense of humility, and that we're a really important part of their life in a moment that matters. People can use the patient card to again more easily pay for care anywhere. That's awesome. I think for us as we look at um, what's the inherent wants of people, and it's like certainty, the ability to choose where they go, when they go, how much it'll cost, like to be a more informed patient. And so we want to ultimately move folks from just paying for care to you know uh, buying care, and that word, that phrase almost feels out of place in healthcare. It for some it probably feels offensive, because if you're buying care, then who's selling care? Like that's can be offensive to folks. But like I, I think that the ability for people to see the price of care before they get care, where that care is being offered, and then golly, like I'm walking in the door with the ability to pay for that care. That's really really exciting for us. that's going to work for some employers that want to bring about that experience to and then for others, I'm just get really excited about just continuing to help whole populations of people and build patient into um, larger and larger health plans because it's clear that a health plan with an enhanced ability to pay for care results, that's winning. Like people like that, they stick with the plan longer. It helps people get care earlier. There's value that's being created for the risk bearer there, whether it's the employer or the insurer, and the feedback that we get. Like I post feedback all the time on LinkedIn. That's real. All of that are real people where we're really helping, and it just helps us. It just drives our team to do more and more, faster and faster, because I think we're pointed in the right direction on this.
I love it. Um, Brian, I'm hoping we can have you come back on at some point, maybe get you on a panel and we can dive into more of what you're doing here and bring in some other people from not necessarily in the same space, right? But some of maybe these other companies that you're working with, these other organizations, and when the time comes, maybe
Absolutely.
some of the plans.
Yeah, absolutely. Absolutely.
Awesome. Well, thanks again so much for joining us on the podcast and look forward to following your journey even more.
Thank you, Jared.